All right, all right, all right, all right, all right. We are on the Life and Health Show, and we promised you we have a very hot show today coming your way, talking about cancer and especially colon cancer prevention. And so, if you are joining us, we want to say thank you. We just went live, so I'm pretty sure you haven't joined. But if you join anytime, those of you on TikTok, you have joined. I see you scrolling up and down there. We're going to be talking about colon cancer, how to prevent it, and a host of other issues that are linked with colon cancer. We have a specialist among us today, and so we want you to do the honors and share the stream if you can, or stay put and watch to the end because it may save your life. Come on, man. It may actually save your life. It may actually save your life. So we are moving forward, and as I have already hinted you, this is what we're going to be talking about: stopping colon cancer. But there are diverse ways we can use to stop this disease, and we want to make sure that every one of you learn a lot today. So our professional oncologist is going to break it down for us, in as much as possible within the next hour. So stay put and let's go through. We have some important questions that I'm pretty sure you have on mind to ask. We're going to ask for you and also give you a chance to ask them yourself. So don't move anywhere. Don't scroll up if you're watching from TikTok, YouTube, LinkedIn, Facebook, wherever you may be catching us live from. If you join later to stay put. All right, so that is the intro for our show. And I think we are ready to roll. Honey, how was your week today?
Mine was really busy.
It was a busy week,
As
right?
usual, yeah, with work and back and forth. And we just came from a birthday party, right?
We,
A
we,
50th.
we went to a birthday party, a 50th birthday party of a dear friend. Come on, man. That's why I'm in the tie and she's in the gold dress. But it suffices. Once a while, we got to be in a tie. So come on, man. All right. So turning 50 is huge. And I'm pretty sure we're going to talk about one of the important things about getting older, 45, 40, 50, thereabout, as we get along with the show. And so we are moving straight to introduce to you our guest for today. And this person is a dear friend, a dear sister, related by so many ways, and in particular by blood. Come on, man. And I'm happy to have her here. We love her so much. So before I talk about her, her achievements and her training and stuff, I want to bring her on the live so that you will know as I speak about her and what she is about. All right. So our dear sister is Dr. Juliet Appiah-Quansah. Come on, give it up for Dr. Juliet Appiah-Quansah. All right, so Dr. Juliet Appiah-Quansah is a board-certified internist, a hematologist, a medical oncologist, and she completed her fellowship in hematology and oncology at the University of Massachusetts in the year 2016, so many years ago. And currently, she is working as a medical oncologist in Missouri, in the state of Missouri in the USA. She's also the founder of an NGO called the Cancer Support Network of Ghana, or maybe I'll just say Cancer Support Network Foundation, and she's going to throw more light as we go forward. She's compassionate about caring for people. Of course, that's why she went to medical school, right? All right. And so she's going to do us the honors to break down some of the questions that we have on colon cancer, so that if you have any questions, unfortunately, those who are watching from TikTok, you cannot see her because she's not in-house. We actually get into her by way of software, and so she's showing up on our YouTube channel. If you want to switch to YouTube at Dr. Oteng, same name you clicked on, and on our YouTube channel, you can see the entire presentation, some of the slides she's going to show us about colon cancer, an important thing to be looking at today. And so that is Dr. Juliet Appiah-Quansah. Dr. Comeback, welcome to the Life and Health Show.
Thank you. Happy to be here.
Right. Thank you. Thank you. We appreciate you so much. You're a busy person. She's a mother of two, happily married. She's not looking, guys. Come on, man. She's already saying. And dearly beloved of God. She loves the Lord. And that's why I say we are related by blood. All right. So we are going to move straight into our conversation today with some of the questions that we have. And before that, Doctor, is there anything that we probably would want to share about yourself that we did not mention that pertains to our discussion today?
Oh, I think you've covered it all. It's not much, so
Oh,
I
it's a
think
lot.
you've covered it all.
I
Yeah,
actually
it's the
didn't realize.
important stuff you've covered, and I hopefully at the end I will get to speak to you guys a little bit about my NGO, something I'm very passionate about. But yeah, I think you've done justice to the introduction. Thank you.
All right. Thank you. Thank you. Thank you. Come on. Thank you so much. Thank you so much. All right. So, with that being said, then our topic, as I said, to bring the full topic into perspective, is how to reduce your risk of colon cancer. The tips that she's going to give, and then also talk a little bit about colonoscopy. We put these together. There could be two different topics, to be honest with you, but we want to make sure we don't miss anything in this hour. So, we're going to be talking about how to reduce your risk, who is at risk, and all those things. But before I even go further, we probably should see what are some of the things we're going to be getting from the stream today. So the first few, we think that at least these six things are going to be shared on the stream. So stay put and share the stream if you know somebody who is interested in health or who is concerned about their own health. And the first couple of things we're going to be talking about is how common is colon cancer, and then we're also going to be talking about the symptoms of colon cancer. And give to you want to
We will continue with risk factors of colon cancer and how we can learn about the screening.
risk factors and how we can learn about the screening, how to detect it, and then from there we're going to be talking about some of the diet and other lifestyle changes that you could potentially do to prevent colon cancers. And then we will give doctor the chance to advise people who are already dealing with colon cancer or any other forms of cancers and see if they can actually take some benefit from the stream. All right, so we're going to move forward. Let me see if I can get my questions back. Yes. All right, so our first question then to you, Dr. Juliet Appiah-Quansah, is how common is colon cancer, and potentially what are some of the groups that are really affected?
Okay. Yeah, so I'm going to answer that question, but I feel like before we talk about anything related to the colon, people need to know what the colon is and what it does. And usually we group colon with rectal to do when we talk about colon cancer because it's a continuum. The rectum is a continuum of the colon. We tend to group them together. So I'm just going to show a picture and go over quickly what the colon and the rectum is, the organs that we are talking about, and what their functions are. And then I can answer this question for you if that is okay.
Definitely. All right, you can go ahead. You have the screen to share.
Okay. All right. So this is the anatomy of the colon, which is also known as large intestines. I think some of us that grew up a little bit in Ghana and Africa in general, we use large intestines, but over here it's called colon and also the rectum. So the colon, I'm not sure if you guys are able to see my arrow, but the
Yes.
colon, yeah, okay, is this whole tube, hollow tube here. And is divided into four sections. You have the ascending colon, which is the continuum from the small bowel. You have the transverse colon. You have the descending colon, sigmoid colon, and then the rectum is what connects your colon to your anus. So what the colon does is it eliminates waste. So when you eat the food and the food is digested in your stomach, it passes through the small bowel in which the small bowel obtain, like, a lot of the nutrients that you need, and then it pushes the waste into your colon. Is the colon that is going to eliminate that waste along with some fluid, water mainly, and some electrolytes that will go with the feces. It also absorbs some electrolytes for your body as well. And basically, when the stool or the feces pass through the colon, it comes to the rectum and is stored there. So the rectum holds that stool or the feces um, until your brain tells the rectum that, hey, it's time to release it. And then it releases it. It eliminates waste. It does a lot of work. So there's a lot of activity that is going on through the colon. And this is how is easy able to develop these polyps, which we'll talk about, and eventually turn into cancer. So, with that being said, your question on how common is colon cancer. So, I'm just going to group colon and rectum together as colorectal cancer, because the same cancer that affects the colon is the same thing that affects the rectum, and they are treated similarly, actually. So, it is estimated actually in 2024 that about 152,810 cases will be diagnosed in United States alone of colon cancer, and about 81 or 82%, 82,000 of these cases will be in males, and 71,000 will be in females. Unfortunately, colon cancer is the second leading cause of cancer death when you combine males and females together, with lung cancer being the first. If you separate males and females, then it is the third, deadliest cancer in females and in males as well. Following in females, following breast cancer, and in males, following prostate cancer. So it's fairly common. And especially in people of color, African Americans have about 20% chance of developing colon cancer compared to their our Caucasian counterpart, and unfortunately, about 40% more chance of dying from colon cancer when compared to Caucasians. So that's how common colon cancer is.
Wow, wow, that is a good way to start. That's very, very interesting to know that it is such a very common disease. Most of the time when you think about cancer, the first thing you think about is breast cancer. I didn't know this was actually that common.
Yes.
And hopefully by the end of the show, we will be able to tell how to protect ourselves. Be able to go through some of the things that we can do to protect ourselves. All right. So with that being said, we'll move on to our next question then. Second question to you, Doc, is that, are you want to read that question for me?
Okay, so what are the most common symptoms or warning signs that we have?
Okay. So unfortunately, a lot of people develop colon cancer or rectal cancer without having any signs or symptoms.
Mm.
Uh, and as you rightfully said, I'm a hematologist as well. So I treat blood disorders. And one of the blood disorders that I commonly treat is iron deficiency anemia. And that is one of the common signs or symptoms that I have seen in a lot of colon cancer patients. So most of them will come to me for iron deficiency anemia. And because I know colon cancer can cause this, I will send them to a GI physician. And lo and behold, they will do a colonoscopy and they have a mass. And I will say, based on experience, when you look in the books, they do talk about anemia, but that's not the most common signs that they talk about. But from experience, I've done this for 7 years. If you include my 3 years of training, that's 10 years.
Wow.
So I see that about 3 in 10 patients between the age 50 and 70 years old that I see that comes in with iron deficiency anemia turns out to have colon cancer.
Mm.
So for me personally, I feel like iron deficiency anemia is the most common sign or symptom that colon cancer patients may present with. And if you have anemia, then you tend to be fatigued. So fatigue could be a sign of colorectal cancer. Bowel changes, so I recently, I think last week, beginning of last week, I saw a new patient, and she was telling me she's 52 or 53 years old. She was telling me that ever since she can think of, she's always been constipated. She's one of those people, they say that half of the world are constipated and the other half have regular bowel movements. So she's been one of those people that, she doesn't move her bowels regularly, like most times every 5 days or every 7 days,
Mm,
So when she hit 50, she wanted to do colonoscopy, but then COVID hit. So she
mm,
couldn't. And then COVID now subsided last year, tried to get it. Something came along and she couldn't get it. And she didn't have any symptoms, no symptoms at all. It's just her chronic constipation, and she's turned 50 and she wanted to do colonoscopy. And so lo and behold, they did a colonoscopy, 6 centimeter mass she
wow.
had. And she came to see me. She's gonna have surgery, and then we'll take, we'll talk about treatment afterwards. So bowel changes, some people, especially chronic constipators, you want to make sure you're talking to your doctors. Other things, including some people may have abdominal pain. I have a personal friend 3 years ago was diagnosed with colon cancer, and she had been going in and out of the ER with abdominal pain. They did CAT scans and they couldn't detect anything. Finally, she ended up having colonoscopy done because they couldn't find what was causing her abdominal pain. And lo and behold, she also had colon cancer. It was resected. She did chemo and she's doing fine. So abdominal pain is also one of the signs. I say by the time you get to weight loss, it means that the disease has already spread. Okay, so most of these symptoms, by the time you start having it, it means that the disease is like, advanced, either locally advanced or it has spread beyond um, what where it started from. And then rectal bleeding, especially rectal cancer, so anytime you see blood in your stool, it's not a good sign. You should always report to your doctor. I always say that it's better to hear it from the specialist mouth than to sit there and diagnose yourself and think it's nothing. Go and do that colonoscopy or sigmoidoscopy or anoscopy. Let them make sure that there's nothing there, and at least you know that there's nothing there. So blood in the stool, having a black tarry stool or bright red blood per rectum is never a good sign. We know that hemorrhoid can sometimes bleed, but go and have the evaluation. Let them diagnose you with hemorrhoidal bleed, and make sure that this is not cancer. So these are some of the common signs, but most colon cancers usually does not present with any signs or symptoms, and that's why screening is very important.
Wow.
Good.
That's a lot of info right there. My goodness. I have a couple of follow-ups. I think one of them you actually touched on um, with the hemorrhoids. But before that, for the iron deficiency, is can you explain? Is it because people who are usually iron deficient, is it because they usually bleed and they lose a lot of blood, and so they end up having iron deficiency, and then that is because of the bleeding is due to colon cancer growing, or it's just the nature of the disease that if you have a mass developing in your colon, you are going to lack iron. I
No,
don't know if the
so
question is clear.
because of colon cancer tends to bleed a lot.
Okay.
And it may not be brisk bleeding, so you
Mm.
may not see it in your stools. It oozes and leaks little bit at a time. So some of the testing that we do that we will talk about later when we talk about screening, actually detect these blood in your stool. So you become iron deficient because you're losing blood, and the blood is due to the fact that you have that mass that is oozing. Yeah.
Okay. All right. And my other, you have a follow-up?
Yeah, I think the first question you mentioned that is very common in the black
Population.
community, yeah, community more than the Caucasians. Can you explain why that is so?
So, like most cancers, unfortunately, I think is our genetic make, our DNA. Like most cancers tend to be more aggressive or more common in people of African descent, and we see that the most aggressive ones tend to happen in Black people, the right-sided colon cancers, which tend to be more aggressive. And that's why a lot of Black people tend to die from colon cancer as opposed to Caucasian counterparts because of where it forms and the fact that we don't like to see our doctors. We
That's the truth.
people, and especially where I come from, our Africans, we are doing our doubles and our triples, and it's very hard for us to let the money go and see our doctors. So even diseases that are not killing people tend to kill us quicker because by the time we come in, it's already spread, and there's not much we can do about that. Yes, we can treat you, but the treatment is palliative, to buy you some time as opposed to if it was caught early. So the black factor is more of genetic make and also the fact that we don't show up on
Mhm,
Mhm.
time. And there's also some healthcare disparities also when it
mhm.
comes to blacks and Caucasians. Yeah.
I see.
Thank you.
Good. And I have a follow up on the rectal bleed and hemorrhoids. In my practice, I can say that it is one of the most common complaints, about people who just walk to you in a pharmacy, and sometimes people don't ask, they just go in there and look for, you know,
Preparation
some
age.
preparation age or some anti-constipation medication, whether fiber or whatever. But I can say that it's a lot. I see people complain of that a lot. Now, would you say that um, people should be very concerned, or as long as they see their PCP and they say that, oh, it's hemorrhoids, it's fine? Or should people, basically what I'm saying is, if they are under the age, which I'm pretty sure you're going to talk about, the age for screening, if they are seeing repeated bleeds and the PCP says it's a hemorrhoid, should they just ignore them and demand a colonoscopy? Because it's a lot of rectal bleeds.
So usually, like rectal hemorrhoids are very
Mhm.
common, right?
Mhm.
But not all of them bleed, right? If like if you have external hemorrhoid, you tend to have a little bit more pain. Internal hemorrhoids don't cause pain, but when you start to see a lot of bleeding, I think you should see your PCP first. It should always start from the PCP. Some of them will do a rectal exam, okay, to make sure that this is hemorrhoidal bleed, and they can feel and they can see the blood on the glove finger, by doing a rectal exam. But if they do it and, like, let's say they are not seeing much hemorrhoids, but there's, like, blood in the rectum, that's an alarm, that's a cause for concern. And I'm pretty much sure that primary care physician would refer you to a GI specialist, for colonoscopy. But like I said, there is healthcare disparity. Believe me or not, it's
Mm,
still happening. It's still going on, in which certain populations are just not getting equal healthcare opportunities. So sometimes you have to advocate for yourself. I always tell my patients that trust your instincts.
mhm,
If your primary care physician says that, what, I think this is hemorrhoid, but you feel that it's bothering you, just tell them, let me go and see the GI specialist. Let them tell me. Always seek to see the specialist. I will not be doing a job of neurologist because that's not my specialty. I won't, like, be diagnosing people with maybe sarcoidosis in the pulmonary area because I'm not a pulmonologist, but hear it from the specialist mouth. Let a specialist tell you that this is a benign thing. That will give you that sense of peace, especially we, the Black people.
mm.
You have to advocate for yourself.
Oh my goodness, especially because it affects a lot of blacks more, right?
Mhm.
All right. I guess we can move on to the next question. That is a very important information right there. So our next question is going to be my third question here, and it is, what are the risk factors? How can you actually reduce those risks? That's a loaded question, but you can break anytime and we'll come back with follow-ups if it's too much. Yeah, go
Sure.
ahead.
Sure. Yeah. So, what is risk factor? Somebody will ask, what is a risk factor? We are talking about risk factor. What is a risk factor? So, a risk factor is anything that increases your chances of developing certain disease. In this case, we are talking about colorectal cancer. So, anything that can increase your risk of developing colorectal cancer is a risk factor for colorectal cancer. And usually we divide these risk factors into two main categories: modifiable and non modifiable.
Modifiable
So,
risk.
modifiable means that you can modify that risk factor. You can actually do something about that risk factor to prevent that risk for leading to the disease. And then the non modifiable is the things that you cannot change. And we know that colon cancer tend to the risk of developing colon cancer up until more recently, we knew 50 to 60-year-olds, even though they would say the average age of developing colon cancer here in the US, I think in males is 67 or 68, and in females is 69 years old. We are seeing that a lot more younger people are developing colon cancer. So you can't do anything about your age. Like, you cannot stop yourself from aging. So age is a non-modifiable, risk that you can't do anything about. Something like your sex. We know that colon cancer is more common in males than females. So you can't do anything about your age. And then there are some inheritable syndromes, which we'll talk about later, that predispose certain people for having colon cancer, and you can't do anything about it. And then if you have family members like, mom or dad or sisters or brothers that have had this disease, your risk is higher than the general population. So these non-modifiable risk factors, unfortunately, there's not much we can do about it, but we can stop it. Like, we can detect cancer early by screening early, when you have any of these non-modifiable risk factors. Now, the one that I want to hammer on is the modifiable risk factors, and these are things that you and I can do something about, and we need to do something about it to reduce our risk, and that's our eating.
Mm.
Our diet is very important in colon cancer. So diet full of red meat, um, processed food is a risk factor for colorectal cancer. We know that people who are low in vitamin D, studies have shown that, they are at risk for colon cancer as well. um, Smoking has been implicated. The risk there is not so strong. Smoking and alcohol, it is there, but it's not as strong as in other cancers like, lung cancer or breast cancer. It's also an inactivity.
Mm.
Mm,
Like, not exercising, that is a strong risk factor for colon cancer. So we know that these modifiable risks, we can do something about it. We can monitor what we are eating, we can exercise, make sure that we are getting enough vitamin D. Last time I was thinking, okay, maybe that's why maybe colon cancer is not, as common back home, because we get a lot of vitamin D. We get a lot of vitamin D back home. You can exercise, like, alcohol in moderation and not smoking to kind of reduce your risk. Yeah.
wow. Wow. That's a lot. That is, I like the idea of the modifiable risk factors that you especially brought it to the end, because that's what we can do something about.
Yeah.
Now, you mentioned that moderation in alcohol, and obviously vitamin D, which is also good. I'm pretty sure you would say that you have to ask your doctor first before you take vitamin D, right?
Mhm.
Unless you assume that everybody should supplement. What is your stance on that?
Oh, well, like, I would recommend that you supplement it, but it's if you're going to take it, you can tell your doctor about it, so that your yearly check, maybe they will check your vitamin D level just to make sure that it's not like, excessive. But vitamin D is actually very good for a lot of things as well. Um, yeah, so I don't think it hurts to take extra vitamin D, but just make sure that you mention it to your doctor.
To your doctor. All right, I like that. I like that. All right. Now, if you are watching and you have a question, make sure you write the questions down and share with us at the end of the stream. We will take questions if any viewer has a question. We will take those questions. What's my comments thing here?
There is one important modifiable risk factor that I forgot, and it's very important. So I have to talk about it. If you give me
Yes.
one, yeah, and that's obesity.
Mm-mm.
Obesity is a risk is a high risk for colon cancer, and that's because of the fat cells, turning into like, turning into like mutated cells or something like that. But obesity is a high risk for colon cancer. So if you are heavy, it brings us back to exercise and diet.
Mm.
You know, uh, making sure that you reduce your weight is very important.
All right. All right. All right. That is good. So obesity also as a risk factor. Now, apart from the red meat, do you implicate any other foods at all? I know red meat is really there. Is there any other foods that you think are
Processed
suspected?
food, processed
Processed
foods,
foods.
Mhm.
processed foods, and any food that you're cooking in high heat. As Africans, we cook, we cook our meats, we cook
Mhm.
our food, So food that are cooked with high heat, like, and processed food, especially, plus red meat. So if we are talking about that, what are the things that you should be eating, right? And that's
Mhm.
Mhm.
like fruits and vegetables, the green leafy fruits and vegetables, colorful vegetables, are things that you should make sure is a lot on your plate, compared to the other things. Of course, we are not telling you that not to eat red meat, but in moderation. In moderation. We Africans, we don't know moderation. we, we we have our fufu and it's covered with meat.
Mhm.
Can eat more fish. That is also very helpful. Like the omega-3 fatty acid fish, like sardines, salmons, and stuff like that are really good. Yeah.
All right. That is good. That's good right there. Now, you have any follow up?
Yeah, so you mentioned that it's not colon or colorectal cancer, right? It's not that common in Africa, but more so here. That's what you're trying to allude into.
Mm.
And you mentioned that because of the sunlight, we get the vitamin D from. So I'm thinking that maybe because there is not much sunlight here, that's why you are also advocating for supplementation of vitamin D. So is it really true that it's not as common in Africa as much more
Oh,
here?
that's my theory, so it's not nowhere in the books. That's what I was thinking. But even in Africa, it may be that because they don't have the screening programs in place, right, to be able to detect this. And maybe people are dying from the disease that we don't know about.
Even
But
no. Okay.
not one. And we know that low vitamin D is a risk factor. So maybe it is serving as a protective factor for most Africans. But it's remember that risk factor is not just one thing that
Hmm.
causes you to have the disease, right? It could be multiple things that plays into. But of course, knowing the nature of the country that we are in, we don't get like because of the seasons that we are in, we don't get enough. And for me, the population that I see a lot of people with vitamin D deficiency. I see a lot of people with vitamin D deficiency. So um, it's not a bad idea to supplement it. And even if you want to talk to your doctor first, to check your levels and see. I think taking 1,000 to 2,000 units a day is not a bad idea. If you are very deficient, if they check it and you're very deficient, then they will put you on the 50,000 units per week. But it's my own theory. So
No, it's
it's my own theory. There's something that I was analyzing and thinking, but
Okay.
maybe that because there are no screening, like programs in Ghana, and maybe people are not even showing up to their
Mhm.
doctors,
Right.
with problems because they're doing all these herbal stuff and people are dying without being accounted for. So
Okay. Thank you.
definitely
Yeah, I think I heard that because of the melanin or our color, we are not able to absorb the vitamin D as
remit it.
much,
Yeah,
to the level that is very good so that we don't fall under it being deficient. So that could be it too.
that could,
mhm.
yeah.
Yeah.
All
Okay.
right. All right. So if we'll move forward, and I think that vitamin D issue also came up. I was giving a presentation on prostate cancer, and they said the same thing about vitamin D. So I think we have to take a look again. And it's a doctor that I follow, Dr. Campbell, also from the UK, and he actually dissected a study that actually said that the recommendations that they are even telling us to take, to supplement are way too low because according to him, like you're saying, people who even were diagnosed with cancers, who, if they supplemented vitamin D levels, their chances of survival were even higher than people
Hmm.
who did not. So I take that. So that
Yep.
point is really well noted. We're going to try and supplement, and we'll tell our doctors. We'll tell you guys about it before we do.
It's a necessary introduction medication too. Patients that have had colon cancer and
Mhm.
have been treated, we put them on vitamin D and aspirin as for secondary prevention as well.
Prevention.
So very important vitamin.
Good, good, good. All right, so we'll go to the next question. And our next question is number 4. And it's how important is screening for prevention for colorectal cancers? Mhm.
This too is a loaded question. So, I usually like to define things for people, before we talk about it. What is screening, right?
Mhm. Mhm.
So, screening is any test or anything used to detect a disease before it starts manifesting, right? Before patient develop symptoms. So when we talk about colorectal cancer, it's one of the cancers that is very preventable if we stick with screening. Screening is so important because if we are all doing our screenings, colorectal cancer, um, numbers will come down very low because we know that every colorectal cancer started as a polyp. Okay. And over time, and I was gonna let me show a picture why I
Okay.
talk about this actually. Okay. All right. So this is what a colon cancer look like, but it usually starts like so this is a normal colon and you develop polyp. And if you do your screening and we detect this polyp, they just clip it at the root and that's it. Okay. Um, but if we leave this here long enough, then it will turn into colon cancer. Okay. And so that's why
So,
colorectal, I mean,
so
that's why
before you go, let's use from left to right to actually see because we couldn't see your arrows proper. So the left one on the
uh-huh.
screen, more yellowish, is the normal colon.
Yes, the normal colon. If you have, I have them written there. So can you see my arrow now?
We see the arrow. Yes.
Oh, okay. Okay, so this is the normal colon. That's how the normal colon looks like. And this is a polyp, which is a benign growth
Mhm.
uh, in the colon. and a lot of us are walking around with polyp. There are some that when they take it out, it will still be in benign form, and there are some that will have some high risk features, meaning that if they leave it there or if they have left it there for like a year or so, it was going to turn into cancer. Okay.
Mm.
And then when we go here, that is how the colon cancer looks like. So the reason why screening is so important is that if we screen you, we can clip this polyp, we can take care of it, and it will never develop into cancer. And even if it has started to develop into cancer, we will catch it at early stage. You will probably have your surgery and never need chemotherapy. It will not spread, to cause you to die. So this is the reason why screening is very important. Screening will help us lower the number of cases that we are diagnosing, and also the number of people that are dying from colorectal cancer.
Wow, come on, man. That is, you see, there's a saying that say, uh, what's the saying? 1,000 images speak better than words, right? There's a saying for that. Those of you who are watching on TikTok, if you can switch to the YouTube channel, and you will see some of these images that Dr. Quansah is presenting, and you can see her too. You need to see her. Come on, man. All right. I love your images. They are so profound. You can tell. That's why I wanted to use at least the color, so if somebody can read, they will
Yeah.
know what you are talking about. This is serious. So you are saying that if somebody can get the screening early enough to detect those polyps, they will just clip it. And I like the way you use the word clip. It's just like a little clip. Clip it right there, and it's gone without any issues into developing into difficult cancers to treat, and the whole God forbid leading you to pass away. So that is very important. And you have any follow up to that? You have any other images to share on this line, or we should move forward?
We can move forward.
All
We
right.
can move.
So with that being said, then I think we'll go on to. So I have a follow up on the screening. I don't know
Okay.
if I made it into a full question. Um, I'll ask it. If it comes up again, we'll just skip it.
Okay.
When you were doing your presentation initially, you said that it affects more people of African origin, or people of darker skin tone. Does that mean that the screening recommendations also change in terms of the age for people? And while at that, what age do you, as the oncologist, suggest that people should ask if they have not already received a colonoscopy or that screen?
Yeah, so I always tell people of African origin, that's African Americans, Africans in the diaspora, to start talking to your primary care physician when you turn 40 about, colorectal cancer screening. I think up until recently, the age cutoff was at 50. Everybody gets screened unless you have some of the non-modifiable risk that we talked about, like, family history, inheritable, like, syndromes that can cause this. And then they brought it down to 45 initially in African Americans, but now everybody is supposed to start screening at 45, because what we started seeing was that because we started the screening at 50, so the people that were diagnosed, like, the incidence rate, which is the number of cases that we are diagnosing,
Mhm.
was started going down in people age 50 and above. But then we started seeing younger patients, like, the rate started going up in younger patients, especially between 45 and 50. 45, 50, 55. And so more recently, they've lowered the age to 45. You have to start screening. But let me use this opportunity to tell people, so if you have, like, a mother or a father, or a brother or sister who was diagnosed of colon cancer, like, especially at a younger age, you want to start screening 10 years from when they were diagnosed or when you hit 40.
Oh wow.
Oh.
Pause right there. We never thought about that. Wow.
Yes, let's
So.
mother was diagnosed with
Mm-hmm,
colon cancer at the age of 29, right?
mm-hmm.
Is that at the age of 39, you start screening. If she was diagnosed, let's say 35, the 10 years will come. I mean, the 40 will come before the 10 years, right? So at the
Right.
age of 40, you still start screening. Does that make sense?
Mm-hmm.
You start screening 10 years from when that first degree family member was diagnosed or when you hit the age 40, right? So
Okay.
whichever one comes first.
Whichever. Okay. I see.
Whichever
Whichever one comes first.
exactly. If the 40 comes first, you start screening. If the 10 years come before the 40, you start screening as well. Um, and like,
Doc,
those people that
let me
have
let me let me pause you right there before you continue. Keep your train of thought. Would you recommend that for all cancers, like breast cancers or any of the other cancers, or just colon cancer?
no, so most of the cancers, yes. Breast cancer, prostate cancer, most I think it cut across actually, with exception of like leukemias and lymphomas and things like that. The liquid tumors, not really, but most of the solid tumors, yes.
So 10 years from when your first degree family member was diagnosed, or
In
for.
the age, yes.
Okay,
Yeah.
Okay.
go ahead then.
Oh, what was I saying?
Oh,
Oh, I was
maybe you lose your train of thought.
so there are, and I think maybe we'll talk about this later. But since we are on the screening age and stuff like that, I think it's important we talk about it. So if you have any of the inheritable syndromes, such as familial adenomatous polyposis or HMPCC, or like some of these mutations that predispose you for having colon cancer, then you have to start screening early. Because we know that these people develop cancer early. So some of them even start the screening in their 20s.
Oh
Uh,
wow.
Mm.
so usually that's why it's very important to know your family history. When you go to your doctor, you need to be able to tell them, hey, like, my dad had like, first colonoscopy at this age and they found a lot of polyps, so what does that mean for me? And your doctor can tell you that, okay, you need to probably go and talk to a gastroenterologist. They can figure out if you are one of those people that needs to be screening early or not. Because we know that these some of these patients have 50% chance of developing cancer by the age of 40. Some are even, the risk factor is even higher. So knowing your family history is very important. If you have a family in which people are being diagnosed with colon or and rectal cancer early on in age, you need to tell your doctor about it so that they can investigate for you. Yes.
The only problem is a lot of people don't even know their family history.
That it's important you get to know your family
Mm-mm.
history. Uh,
Yes.
Do your investigations. Try to get as much as you can. Yes.
Mm-hmm.
Possible. Yeah.
All right. That's deep. Oh man, I'm loving it. You have any
Next
follow up? Or
question. Yeah.
all right, let's move on to the next question then. Fifth question, Doc, is. Oh, go ahead and read this time.
Is diet important for prevention or other lifestyle changes? I think
I
she
think you
mentioned
touched that. Yeah.
most of it
Yeah.
already.
So I think I mentioned this when I was
Mm-hmm.
going over the risk factors. But yes, diet is very important, and we've talked about it. Red meat being one. We love our meat. And red meat is not even just colon cancer. It's
Mm.
implicated in so many other
Many
cancers.
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 So um, modifying that is very important. Eating good diet, like fruits and vegetables, let that be like more than half of the plate, and then the rest, one third of the plate, is very important. And exercise, I can't stress that enough.
Mm.
Exercise is a preventative, like whatever is good for the heart is also good to prevent cancers.
Oh,
Wow.
So
come on, man. Yeah, we might have that on the show.
Right? If the cardiologists are telling you that you need to exercise to keep your heart pumping and your
Mhm.
heart, like, in good health, I will advocate that for anybody who is trying to prevent cancer, because uh it's implicated in many, many, many other cancers as well. So exercise is very important. And sometimes not doing a lot, like,
Mhm.
walking,
Yes.
just taking a walk. I mean, the weather is getting nice now. This is the time to really hit the road, hit the gym, and try to get in as much exercise. Some of us have seasonal exercise. You try to bank a lot. No, you
Mhm.
should be able to exercise at least 3 times a week.
A
you know
week.
and I know our schedules are busy and all that, but let's try to take care of our health, make our health priority as well, because you can acquire all the money, and if you have to use them on drugs, then what is
Mhm.
the use of it?
Mhm.
So it's very important that we incorporate some exercise. If you can't do it during the weekday, try to bank a lot over the weekend,
Weekend.
uh, in exercise, and the diet too. Let's put aside, not like entirely, but in moderation, I would say. Yeah.
Okay, as a follow up, I also learned that people who like to grill their foods a lot, burnt foods, really charcoal grill, I mean, really dark burnt meat, it contributes, as apart from just being a red meat. If you eat foods that are always burnt on either on the stove or wherever, it's not good. Do you support that claim?
Yeah, so grilled food, I know this is very true for stomach cancer. We see a lot of stomach cancer in Asians because, like, of smoke food.
Mhm.
They smoke a lot of their food, and stuff like that. So yes, it's one of the risk factors. Like, and that's why I said, like, high heat, like,
I
food
eat.
that cook in very high heat. Because you destroy some of the DNA,
Mhm.
in the food, and, like, somehow, like, there's reactions that take place, that can lead to these cancers. And cancer is just like, a defect in your DNA, like some of the repair mechanisms are not working, and that's what causes us to form cancers. So, um yeah, I support that,
I
actually.
support that. Yeah, because they're saying that some of them may actually generate free radicals, which
Yep.
when they come in
Mhm.
contact with your colon can do that. Okay, good. I think we can move on,
Yeah.
right? All right.
I
That's
believe.
good. That's good. That's good. We're doing good on time too. All right. So our sixth question then, go ahead and read this time.
What advice would you give anyone dealing with colon cancer?
Oh, I mean, as an oncologist, I walk this journey with my patients. Every patient is a family member to me.
Mhm.
Mhm.
So the advice that I will give my father, my mother, my brother, my sister is the same advice that I give to these patients. Don't feel like you're doing this journey alone. This is why we are all here. Your doctors, your family, we are all here to cheer you on, to be able to fight the fight, especially if you make up your mind that you're going to fight. You
Mm.
know, never feel alone. Like, don't isolate yourself so much that you feel like you're walking this journey by yourself. We are all here, to support you. So
Mm.
talk to us, and it shouldn't be just on the cancer, social, psychological, financial, whatever. We have all the resources, so we need you to talk to us. And then the other thing that I tell them, that don't play down of any of your side effects or your symptoms, even if you feel like it's nothing but it's new to you. Tell us about it,
Mm.
let us address it, because what you may think that it may not be anything significant, for me that is using these drugs to treat you, I have seen what it can do, and it may be significant. I remember a case when I was doing my fellowship. A woman came to our clinic in the morning, chemotherapy. The person was on chemotherapy, came to our clinic in the morning, was doing okay. We checked her labs. She had what we call neutropenia, meaning that the white cell were down. Okay. She left the clinic maybe around 9:30, 10 o'clock. At noontime, she called and she said she's having fevers. So we're like, okay, you were neutropenic, so you have to come to the ED. Got to the ED maybe around 1 o'clock, and by 3, she was dead
Wow.
from neutropenic infection. you know, and all she had was a fever. She wasn't feeling even really sick. So I always tell my patients that are going through treatment that don't play down any of your side effects. If it's new to you, I need to hear about it, or my nurse need to hear about it. Somebody needs to hear about it. Let us tell you that, oh, this is nothing. You can move on with your life. And for those who has already completed treatment, so once you get cancer, you're always a survivor, right? Whether you're going through treatment or you have finished treatment, or like uh, how long ago you had treatment, it doesn't matter. You are always a survivor, and so always pay attention to your body. If something doesn't feel right, you let us know. You call us and let us know. There are a lot of things that people who have cancer go through, even psychologically.
Right.
It's an emotional journey, for a lot of people. And so we, as the healthcare team, are there to assist them and to help them. So if you're here and listening to us and you're dealing with colon cancer, my advice to you is that don't feel alone. We are being paid to be there for you. Okay. So make sure you talk to your healthcare team. Find somebody. If it's not your doctor, maybe the nurse, like whoever you feel comfortable with, but talk to us about every aspect of your life, every aspect of the journey, because there may be things that we may be even able to assist you with that you never thought that we could. So that would be my advice.
Oh, come on, that's a good one. A good one. Thank you for that assurance to a lot of people. Now, when you said survivor, I think you were careful to say that if you beat it, if you beat cancer before, you're a survivor. So any little thing, tell us. Are you implying that if you survive any cancers, you should also make sure that you are always monitored to make sure nothing comes back up?
Oh, yes, that is very important of part of the survivorship, right? So
Hmm.
once you have one cancer, your chances of having others is higher than the general population. You should know that.
Hmm.
Uh, and then the chances of that cancer coming back is higher than somebody who has never had cancer before, right? And so when we take people through survivorship, this is why we follow people, for many, many, many years. You still come in for appointment. Even when we hit the 5 years, most people, like, except some of the leukemias, but most of the solid organ, we see them at least once a year, and we are always available for you to call us. Just Thursday or Friday, I got a message about a patient, like from the emergency department, about a patient who was diagnosed with diffuse large B cell lymphoma about 10 or 15 years ago, treated, doing fine. All of a sudden, started having some abdominal discomfort, comes in, and she has all these masses, that they feel that the cancer may be back. So it's been 10 or 15 years, right? And you can imagine that if she had not come in, or she probably thought that, oh, this is nothing, and probably sat there for a little while, and finally, like, when the pain became unbearable, came in, and this is what we found. And so you should pay attention to your body. Once I always say that once you go through chemotherapy, your body is never the same, and this is the reason why we want to prevent it before you even have to be exposed to chemotherapy, because you are never the same after chemotherapy, no matter what. Cells have been damaged. Chemotherapy kill cancer cells, but it also kills good cells. The good important is that we have the repair mechanism. The good cells have the repair mechanisms to repair themselves, and we know that the chemotherapy is going to save your life. So even though you're going to have some side effects, we'll give it to you to save your life, because if we don't do that, then you're going to die from the cancer. So don't downplay any symptoms if you have had cancer before. Even if you don't want to go to your oncologist, go to your primary care physician. And once you have had cancer too, you cannot not do your yearly physical or every 6 months check. You can't skip. You like, we don't want anybody to skip it. But people who have never had cancer, maybe they may get away with it. But if you have had it, and especially you are not following with oncologists anymore because your 5 years or your 10 years is up, make sure that at least you are seeing your primary care physician, because some of these cancers, we can detect some stuff in the blood that will tell us to do subsequent testing to make sure that the cancer is not back. Yeah.
All right, all right. That's good. That is a lot to take in. All right, let's see if we have, unless you have any other.
No, let's go.
Okay. So let's move on to other question we have. Yes. Any insights on latest research and diagnosis or treatment? Do you have
So,
any message of hope? Any interesting things to share
oh,
to people?
yes, yes. So I will stick with the therapy part because I do chemotherapy and immunotherapy and targeted therapy, but very, very exciting things. This is why I love oncology so much, because it's very dynamic.
Right.
Every day, like every month they're releasing something new. And
Yeah.
these days, with precision medicine and targeted
Mhm.
therapy, we're doing a lot. One of the novel agents that we have now for colon cancer is immunotherapy. So people that have stage 4 or metastatic or colon cancer that has spread beyond the colon, if you have what we call MSI or microsatellite instability that is
Mhm.
high, which is the DNA repairing mechanism that repairs our DNA. If that DNA repair mechanism is damaged, we can give you immunotherapy and patients are doing quite well. I have a patient who came in with, I did not diagnose that patient. The patient was diagnosed somewhere in Ohio. And when I got her, she's been on immunotherapy for a year and a half, and her cancer has melted away.
Wow.
And the good thing about immunotherapy is that the side effects is not as aggressive as chemotherapy. It has less side effects, very well tolerable. And so that's one of the areas that it's very exciting. Nowadays, we're doing precision medicine, in which we are doing next generational sequencing, looking for targetable mutations that you can use to treat, like some cancers like lung cancer. We're doing some of them first line. Colon cancer is still like third and fourth line. That we are using these, but I know that within the next few years, we are going to be using some of these novel agents upfront. Targeted therapies are also very well tolerated because they are targeting, like, a specific mutation. They don't cause so much side effect as well. And most of them tend to be a pill that you can sit at your home and take without having to have a port for chemotherapy or being stuck, to give you chemotherapy. So a lot of exciting things. And I know even at the screening side too, there are some stuff that are coming up, but because I'm not gastroenterologist, I'm not gonna talk much about that. That's not my area. So
Oh man, that's good. That's good. Dr. Hub, immunotherapy.
Yeah.
All right, that's very important and good news to share. And I'm pretty sure with the screening, if it wasn't for time, you would share. But if anybody asks anything, we will actually, hopefully, get to that.
definitely.
And yeah, with AI too, screening you probably won't need a lot. Just the
Right?
screening intelligence can
The
help.
way that things are going.
Yeah. You see, you just feed a computer with a lot of images, and then it learns that. And then whenever they see this, it means there's a cancer, and you probably won't have to. do a lot of colonoscopies. Well, we'll see.
Yeah, so nowadays with the screening, they do CT colonogram, right? In
Mm-hmm.
which you don't do colonoscopy, a CT scan that takes pictures, like refined pictures that it can
Right.
detect polyps and colon cancer. The only thing that makes colonoscopy the gold standard is the fact that you can detect and biopsy at the same time.
The same time.
Oh.
So if we do the CT colonograph and they find the mass, you still have to do a colonoscopy to go in and
Mhm.
biopsy it. So I think colonoscopy will remain the gold standard because of that fact. But like other things to detect the cancer, I think they are making a lot of headways on that. Yeah.
Wow, wow,
Mm.
wow. That's good.
And how often is it done? Is it repeated every 10 years
The
or
colonoscopy.
the
Yes.
colonoscopy? Yeah.
Oh,
Nice.
so it depends. It depends on what they find. So if they go in and they find polyp, depending on whether this polyp is hyperplastic or like, high risk polyp or not, will determine how often they repeat it. So some of the patients may need to come back 3 years. Some may
Okay.
need to come back 5 years. Some may need to, the standard is 10 years if they go in and they don't find anything. But if they find some polyps or like this person, I know people with inflammatory bowel disease like ulcerative colitis and what is it, Crohn's
I,
disease. Yeah, Crohn's disease. I think they have to screen every 3 years because that also put them at high risk for developing cancer. That's one of the risk factors that I don't think I thought I talk about. People with inflammatory bowel disease, and the two main ones are ulcerative colitis and Crohn's disease. So they start screening early, and
Mhm.
I think it's every 3 years they get to have screening colonoscopy. Yeah.
Wow.
right.
Okay.
We have, as I said, we got to watch this on the replay again just to take it all in. It's a lot of. Thank you so much.
Information,
Yeah.
right?
All right. So we are at the point, MC. I don't see any. I see a thumbs up, 5 thumbs up. If you are watching, have you given any thumbs up? Make sure you do that right now. And we are about to wrap up, but do you have any other questions? If anybody has a question, you can put it on. Unfortunately, those for TikTok, I barely can read your comments. But yeah, you can put up your questions if you have any comment, and we will try and get Doctor to answer them. But apart from that, while we're waiting,
Yeah.
do you have any questions?
So, Doc, you were talking about the opportunities and the new technology and all that. So, let's think of people back home, right, where we come from. And
Mm.
I think that opportunity and that accessibility is not as much as here. So, in case any of them find our video, what advice will you give?
So, and you guys probably know that I do a lot of work back home as well. To support cancer patients and education. You just need to talk to your primary care physician. So another problem is cost. The tests are there. Because it's not a national screening program for it. You will have to pay out of pocket. For it. But I always advise people that if you have the money to do it, this is something that is going to save you thousands of Ghana cedis for cancer treatment. If you have to go through the treatment, it's more money than if you do the screening. So if you are 45 and above, I always advise that talk to your primary care physician, ask them where you can get that colonoscopy done. If you come to our platforms or you go to our website, there is some facilities that can do this, that we have listed there as well, that you can reach out. You just have to pay out of pocket, and unfortunately I don't know what the price is, but those tests are available. It's not many centers, but you can, if you want to do it, you can do it. And those that can afford it, I really advise that you get it done.
All right, all right, all right. We use this opportunity to have you tell us about your work in nonprofit area with helping people to avoid or detect or treat cancers.
Oh, okay. Thank you so much for the opportunity to share with you guys my passion. So, I set up an organization, an NGO, in 2018. Initially, we were called Cancer Support Network of Ghana, but we changed our name to Cancer Support Network Foundation. And basically, what we do is we support people who are diagnosed with cancer, and we also educate the public about how they can prevent some of these cancers. You know, we talk about screening, we do a lot of health awareness programs, but majority of our work is really to financially support our patients. We also have like cancer survivors support group in which we have our psychiatrists that help them with some of the psychosocial stuff as well. But we donate to support patients through from their diagnosis to their treatment. Some people need surgery, some people need chemotherapy, some people need radiation. So when they come to us, we donate to them. And one of the important things that we also do is to go to the outskirts of the cities, like the villages that people are not showing up. To do screening programs, like breast cancer screening programs, to try to help some of these women that may not have the opportunity to come to the city to get, to get screened. During breast cancer month, there's a lot of activities going on in Accra, Kumasi, like the big cities, but usually not the villages and the small towns. So we try to extend some of these programs to some of these cities, and I mean some of these small towns and villages as well. Um, and so that's what the nonprofit is about. It's a passion for me. I just came to find out in 2018 that there was not a whole lot of awareness, and even where people can go to get their diagnosis, even when they detect a mass, and then when they go there, how to even afford the testing that needs to be done. And I decided to set up this NGO to support. So it's been family and friends that are helping me to carry on this, and we are always looking for supporters. These are your brothers and sisters back home. Even the African Americans here, our Caucasian brothers and sisters here, we are all one people. And so whatever you can do to support our family back home, I think is very much welcome and will be very much appreciated.
Oh, come on, man. That's good. It's so good. And the thing is, sometimes we think we can't do much, but this is a very busy woman. I told you she is a wife, she's a parent of two, and she is a specialist, an oncologist, a hematologist, and she's doing this. And yet, some of us think that, oh, we are busy, we don't have time. And I think before the show, I was talking to her about it. And not only is she offering her services, she's using her own money. Oh my God, that hurts me. And sometimes it would only need just a few, especially because of the exchange, a few little donations here and there, and they can do a lot. And so I am happy that you have the chance to share it here, and hopefully people will take note and join hands with you, even if it's just one patient at one point in time and that's all they can do. I think it would be a good thing. So I'm going to say
Yes.
that our channel, we're going to partner with you anytime you have any information to share. Let me know. We'll interview you, whatever it is. We'll spread the word. At least that is
Thank
not hard.
you.
And then
Thank you. God
we'll
bless you for
help folks. Yeah. And I think that's good. Right? Thank you so much. And I know some serious people are watching. Our own
Our Reverend.
our own Bishop Cecilia Boama is. You probably know her, right?
Yes,
She's
yes,
a big
yes.
shot, and I'm pretty sure she probably link up with you. Yeah, she should probably link up and also help. And she's
Doc,
also
can you share my screen? I have
okay.
ways in which people can
Your information, yeah. So
support
we
us.
can have.
Yes.
Mhm. Let me share. Where am I now? Okay. All right. Oh, great, great, great. Oh, Doc, you came prepared. All right. So if you want to share, if you want to donate, Doc, you have a minimum or
Oh
anything?
no, nothing is too small. Honestly, nothing is too small because sometimes people just need like 300 Ghana cedis for a biopsy.
Which is
Sometimes
how much in
I,
dollars?
that's like $30.
Oh, come on, man. Mhm,
And
mhm.
especially when we are going to these villages and we detect these cases, sometimes we have like 15, 20 people that needs to come for follow-up. Some of the tests are expensive, but honestly, little here, little there, we combine it, it can still achieve a lot for us. But if you have the big donations too, you are more than welcome. We need
Oh,
it.
yeah. Like that. Now, do you do these screenings like once or twice a year? You have any frequency you do it? Oh,
So we try to do it at least once a year, but last year we did maybe last year we did three, I believe. So
wow.
usually breast cancer month, we always try to do one. Last year, April, we went to Ajumako in the central region and did a 4-day screening program. And then I think in October, we went to Western region, Jomoro, and did a 2 days or 3 days screening program as well. Yeah,
I see. I
but
see.
we try to at least do once a year, but sometimes we may end up doing two, depending on how our schedules are. Yeah.
Wow.
Donations we do throughout the year. Every month there
Oh,
are
yes.
people that come. As I'm talking to you right now, actually tomorrow we are doing donation for a 24-year-old with rectal cancer, diagnosed with
Wow.
rectal cancer, needs 15,000 Ghana cedis to do the treatment. Um, like diagnosis and treatment. We have multiple myeloma patient that we are donating to tomorrow, as well as one breast cancer patient. So tomorrow we are going to do 3 donations to people in our office tomorrow. Yes.
Wow.
Wow.
Wow. All right. We want to thank you so much. I don't know if we have any other thing. And viewers, if you want to help this noble group reach far, that's the information on your screen right there. Because that's the good thing about every little helps. That's why I asked, is there a minimum? That she said there's no minimum. Anything you can part with, remember, it may just be the thing that somebody needed to save their lives. And so it is important that we help because for all you know, it will be somebody that you may even know that,
Yes.
is going through something. And if you don't know them, that's what Jesus came to do, right? Come on, man. He didn't know us. He didn't know us. All right. I think we probably are at the end.
Um,
Yes, we are at the
we
end
have
of our show. And I think Apostle is saying, good job. Good job. Thank you. Thank you. Thank you, Apostle. And the other one that she actually said, which I think, Doc, you're going to be interested in, is she says, we will help.
we will
Oh, come
help.
on, man. Thank you, Apostle.
Bless you, Mama. God bless
All
you.
right, all right, all right. And I'm happy to at least have one commitment. And as we said, we have also committed right here. At least, if
Yes. God
nothing,
bless you,
using
Doc.
this
Definitely.
platform, we will do something. All right. Thank you so much. And do you have any final concluding
Conclusion.
remarks that you want to share with our viewers?
Yeah, I just want to use this opportunity to thank both of you for having me here. I think this is very well needed. What you guys are doing is very commendable, especially in the diaspora. Like, making sure that we are up to date on what is going on in the health world is very important. So I commend both of you on that. And I pray that God will continue to give you the grace and the resources to do this. And I'll take this opportunity to also thank my board and my executives. my board, Dr. Adelaide Opon Jabna, and Dr. Max Zorjochi, for always being there and supporting me to run this. And then our executive, our president, Ekosi Osei, our vice, Eric Brobe, whom, without him, I don't even know how we are going to handle these cancer patients. And all the team, Richard, Ramatu, Riza, Derek, Ato, all the team, these guys are going out of their way to help this organization be successful. They are not taking a penny from me. They are on the ground doing the work for us. Blaze, our secretary, who is an amazing host and talker. Next time you guys want us to do something on any topic, I think I will bring him along. He's doing a great job. So I'm very grateful to all of them. I hope I didn't leave anybody's name out, but they have been a great support. And of course, my amazing husband
Come on,
for
man. I was waiting for that.
always being there and supporting me, taking care of the kids so I can do some of these programs, because if they are around, I won't be able to do it. And my family, my dad has always been supportive. I mean, he donates all the time to support us as well. So I appreciate that. And I appreciate both of you for having me. Anytime you want to discuss any other cancers, just let me know. It's a passion for me. And I always say that I do this because I'm very optimistic. So I'm always looking for ways in which we can help people who have cancer or want to prevent getting cancer. Prevention is better than cure in everything. So if we can prevent as many, then we wouldn't have to worry about what money do we need to use to even do treatment. So once again, thank you, and God bless you for having me here. It's been a great program, and I appreciate both of you.
Oh, thank you so much. Thank you
Appreciate
so
you
much.
too.
Thank you so much. You actually challenged us. People think that we do this for the money. We don't. We don't actually get anything. At least not yet. And uh, for for us to see another person doing this, I mean, just a little chat that we had, or the commitment, even your time,
Time,
the
yeah.
time, the family, your husband. If you don't have somebody who actually understands these things, you can't even, give up yourself to do it. And so for you to give yourself up with all the commitment, donations, including your family, that is deep. And we are challenged by what you do. And to be honest, we are so proud. You think you're proud of us? We are very
Proud
proud
of
of you.
you.
We really, really,
Thank
you
you.
don't know how many lives you are touching there. And we thank God for your life and hope that you can go get more partners to make your life very easy. Just
Amen.
for giving, the leadership. God will bring more people to partner with you, and hopefully you have more impact. That's what we expect. So thank you so much for. Yes, thank you so much, and greetings to the hubby and the kids. Thank you so much for your time. And already I wrote it down. Anytime I want to talk about cancers, trust me, you'll be part of
Please
it.
don't hesitate at all. I can always make time for you guys.
Thank you so much. And this month, I think is a colon cancer awareness month, right? And
Yeah.
what a better way to have you on the channel to do this. God richly bless you.
Bless you.
So hang tight as we close the show, and then we'll be back. So viewers, as you can see, we have come to a very good conclusion. That's a very good one, and Apostle is also registering her appreciation for doctors, saying that God bless you all for what you do. Awesome, awesome, and this is a lot of people are going to watch this later, and they are going to find valuable information that they would otherwise not find anywhere. So we thank Dr. Quansah for coming on the live and sharing her expertise. We're going to get her again, and thank God that she has actually been
Committed.
committed herself to doing it, because we definitely going to get her. There's a lot of cancers on the rise, and she's going to be a good person to talk about them. And so, if you know anybody, 40s, 20s, or whatever, share the stream with them. Let them watch. and hopefully they can also protect themselves. Or if they are dealing with cancers, that advice, that heartfelt advice that she gave, maybe all that they may need, to hang tight and hope for the best. All right. So, do you have anything
No,
else?
we good.
All right. So, with that being said, next week we're going to come back again live. We may go back to our topic of hypertension until we conclude, or we may just do freestyle. I mean, what do you think? Freestyle, just do anything that comes up, or I'll continue with that.
Yeah.
Honey says time will tell. All right. So next week we'll come back again with another interesting topic, and make a date every Sunday. It's 7 p.m. now. We may go to 6 p.m. because the daylight savings and stuff, so that our folks back in Nigeria and Ghana can watch live too. But if not, I will come back at 7. And if you are watching on TikTok, I want to also sound to you that we have a whole channel on YouTube with lots of videos. I know we have a few on TikTok, but YouTube, you would see the doctor's face, has slide presentations, and other things that we have. So make sure you check our channel up at youtube.com/@Dr. Oteng, just like my name showing up on the TikTok thing. Or just go to YouTube and search, and you see the same image there. Click on it, subscribe, and be part of our community, sharing and learning together. All right, so that's about it, right? New other comments. All right, for those who watch on the replay later, if you have comments, put the comments there, and I'm hoping Doctor will make time to go through them at least once a while to see if there are any things that she has to attend to, or else I'll draw her attention to it if there's any specific question relating to our discussion today. All right, so with that being said, we say,
Beloved, we wish above all things that you prosper and be in health, even as your soul prospers.
God bless you.
God bless you all.